doing a back-to-back here, both kind of semi-emergent. We just talked about, what we talk about, Alfie? Natural, you keep this, natural erections, right? When you have a penile implant. And now we're going to talk about tubing. And this comes from a doctor. I'm just going to say Dr. John. He's having a revision surgery, and he's having the surgery by somebody who's a competent surgeon. And apparently on his first surgery, there was some tubing that was either draping across the bottom or the top of his penis that was visible and palpable to him, with that implant. Of course, you always hear that he lost so much length, and I wish, I'm getting tired of hearing these loss of length stories, because erectile dysfunction is the only thing that causes a penis to get shorter. But then he goes into, there was still one area that he's not clear on, he wanted to ask about, and that's the placement of the tubing. And I guess I had spoke to him before about how he could, feel the tubing at the base of his shaft. I don't know if it was done infrapubically. That's usually, you'll see it across the top, or penoscrotally, you might see some tubing on the bottom. Those of us that are dedicated to penile implants, we do everything in our power to conceal that tubing. That tubing is concealed, in a variety of different ways. Infrapubically, or making sure that you have this little rear tip extender on the back. These are all technical things, but sometimes you just can't hide it infrapubically. Sometimes you can't hide it penoscrotally. And if you can't hide it, what is your preference? Okay, Dr. John, what is your preference? To not have a penetrating penis, or to have a little bit of tubing? The reality is, most of us that are in this game of putting in penile implants do our damnedest to conceal it as much as we possibly can. But the nature of the implant is that you have to have tubing coming out from either above or below. And the one thing I suggest you do, Dr. John, is talk to the doc that you're going to, who I know is great, and say, do everything you can to conceal this tubing, because it's bothersome. And if he is a doctor, the doctor I think he is, he's going to say, I will, but I cannot guarantee a damn thing. All right, we need to understand that this is a device that works through tubing that transfers fluid from the reservoir to the cylinders and back. So for those that are thinking about an implant, and you go to hopefully a dedicated center, address this question. Say, I do everything in your power. And then you have to do everything in your power, which is, in our case, you got to pull down on that pump to make sure that tubing does not try to buckle up, because the pump is riding up. And these are all things that your doctor and you need to be completely invested in. All right. So like my orthopedic surgeon said when I blew out my ankle, he said, you know what? You only have about an 80% chance of ever being able to run fast again, let alone wrestle and do the stuff that I like to do. And guess what? When I did it, because I followed every bit of his instructions postoperatively from a rehabilitative standpoint, I made it. So that's my advice, Dr. John. Please take it. Have a good one.